Features of radius and ulna. Radius and ulna are attached to the humerus proximally and to the carpal bones distally. They are separate bones, but they behave as one as they are bound together by the interosseous membrane and proximal and distal radioulnar joints to perform the supination and pronation. Yes, on supination and pronation. When sway injury occurs, the forearm usually involves both bones, resulting in either fracture of the one bone and either fracture of the both bones or fracture of the one bone and dislocation of the other bone, depending upon the severity of the injury and age of the patient. Now, first of all, we will discuss the fracture of individual bones of the radius and ulna. In radius, there are two types of the fractures: extra-articular, which are outside the joint cavity, and intra-articular, which is inside the joint cavity. Extra-articular are also called type A, and intra-articular will call type B and C. Extra-articular fractures of the radius are further of two types: Colles fractures and Smith's fracture. In Colles fracture, there is a fracture of the distal end of the radius 2.5 centimeter within the joint cavity, within the wrist joint. 2.5 centimeter within the wrist joint. Distal end of the radius fracture occurs and the fractured segment moves dorsally or posteriorly, so it is called the Colles fracture. The deformity results in the Colles fracture is called Dynaphog deformity and bayonet deformity. It occurs as a result of the malunited distal radial fracture occurring in the Colles fracture. The median nerve injury is the most common nerve injury in the Colles fracture. Treatment is done by the close reduction and the fractured bone are held in the cast. Now comes towards the Smith's fracture. Is the same as that of the Colles fracture, but the distal radial end, fractured radial end, moves ventrally towards the ventral side or volar side. And it usually occurs due to the fall on the dorsum of the hand. Treatment done is the close reduction and it is held in the volar buttress plate, as it usually slips from the cast, so it is held in the volar buttress plate. Now comes towards the ulna. It usually its fracture results is called nightstick fracture. It's an isolated fracture of the ulnar shaft. It occurs in the mid diaphysis and usually transverse, and it is usually non-displaced, and it results from the direct blow with the blunt object. Why it is called the nightstick? Because it is typically caused by the defensive action of holding one's arm in front of the one's head to avoid being struck by a blunt object such as policeman's baton or nightstick. Treatment is close reduction and cast application. Now there are two fractures: Montigia's fracture and Glazie's fracture. In these fractures, both radius and ulna both are involved. In Montigia's fracture, fracture of the proximal third of the ulna is done. Proximal third of the ulna is fractured and anterior dislocation of the head of the radius at the elbow joint occurs. Fracture of the proximal third of the ulna and anterior dislocation of the head of the radius at elbow joint. It is uncommon and it occurs when there is a forced pronation or by the direct blow on the upper part of the forearm, on the back of the upper part of the forearm. Now Glazie's fracture. In Glazie's fracture, fracture of the distal third of the radius occurs and there is subluxation or partial dislocation of head of the ulna at wrist joint. fracture of the distal third of the radius and anterior dislocation of the ulna. In both of these fractures, fracture of the one bone occurs and displacement or dislocation of the other bone occurs. And Galeazzi's fracture is usually occurs due to the fall on the hand. Treatment is open reduction and internal fixation. Anatomical alignment and rigid plate fixation is required. As we have shown that in Montigia's fracture and Galeazzi's fracture there is fracture of one bone and dislocation of the other bone at any joint, either it is the elbow joint or wrist joint. So whenever a fracture of radius or ulna is demonstrated radiographically, further images of the elbow and wrist joint should be obtained to exclude dislocations.